This is a 42-year-old patient who presented with a complicated cataract in his left eye. The patient had undergone a surgical PI when he was just 10 years old and as a result had thinning of the iris. The patient had a poorly dilating pupil which did not improve even after injection of adrenaline. So we planned to use iris hooks to achieve sufficient dilatation. After staining the capsule with trypan blue dye, 4 stab incisions were made along with the main incision. An iris repositor was then used to break the posterior synechiae all around. And you can see how thin the iris was at the 2 o'clock position. The iris hooks were then implanted. But even after placing 4 iris hooks, sufficient dilatation of the pupil was not achieved. So we decided to place a 5th iris hook. While the iris hooks were being tightened, unfortunately, there was an iris tear at the site of the surgical PI. Now with sufficient dilatation, we could proceed with the capsular access and the hydrodissection. Since the iris was torn at one side, we decided to remove the 5th iris hook. And we noticed that the pupillary dilatation was sufficient enough to proceed with phacoemulsification. The nucleus was then dialed, and phacoemulsification and cortical cleanup could be done without facing much difficulty. Once the cortical cleanup was complete, the iris hooks were then removed. The bag was filled with visco and a single piece IOL was injected into the bag. The viscoelastic was then removed using bimanual IA. And the case was concluded. This was the picture on post-op day 1, and you can see the surgical PI site was torn. 2 weeks following the surgery, the opacified anterior capsule can be seen through the site of iris tear. The patient was doing very well with an uncorrected visual acuity of 6/9.